It's paramount to work with your veterinarian and not make vaccines a convenience, but a science. I'd like to discuss 3 major equine respiratory infectious diseases that we should consider in protecting our horses. The first one I would like to discuss is equine influenza. This is an infectious and very contagious respiratory disease that hits horses from training centers to boarding barns, showgrounds, sale facilities, etc. This virus is known to mutate. When we're looking at flu, it's pretty much like flu in people. These horses are going to break with a fever. They may have a cough. They may have a nasal discharge. These horses they'll look like they feel bad. They'll have a fever. You might see an enhanced respiratory effort. The second disease that I'd like to discuss is equine rhinopneumonitis. This is also a viral disease, but unlike equine influenza, it's really not a type of a virus that mutates. It stays the same, but it certainly causes havoc. We have EHV1 and we have EHV4. With one, we could have respiratory symptoms. We could have abortions in mares, late-term abortion, as well as the neurological form, which is really the most dreaded. And then when we talk about type 4, that's generally a respiratory form. Most of the symptoms with the respiratory form would mimic influenza. And then the third disease that we should discuss is called equine strangles. This is strep equine. Now that's unique in that it's a bacterial disease. It's been along since biblical times, and it's a huge nemesis to the horse populations. Most people would recognize it as enlarged lymph nodes. You'll sometimes see horses with baseball-sized lymph nodes under the jaw. When we talk about equine influenza, we know that if horses are vaccinated appropriately and boosted appropriately, the efficacy of these vaccines, if the veterinarian chooses a current updated strain and vaccinates at the appropriate time, these vaccines are very efficacious. We do strongly encourage horse owners to consult with their veterinarian. Honestly, in their area, in their territory, they are the best source of information. They are cued in by state veterinarians, local veterinarians, universities. They get a lot of data and feedback what's circulating in their area, and that influences their decision on what they need to vaccinate and when. I am Dr. Scott Hancock, and together with your veterinarian's help, we can master equine health.